This is NDTV, and you're watching NDTV 24/7.
Welcome. You're watching Living with COVID. I'm Rishika Barua. As usual, a panel of expert doctors join us to answer your questions of living with the coronavirus. We have with us on the broadcast today Dr. Jayant Kelwade. He's a consultant endocrinologist from the Alexis Hospital in Nagpur. We also have Dr. Purnanand. He is a consultant cardiologist from the Purnanand Institute in Vijayawada, and Dr. Sahil Fulara. He is a consultant endocrinologist from the Breach Candy and Jaslok, as well as the Wokat and Sefi hospitals in Mumbai. Appreciate you, doctors, for being with us on the broadcast. Dr. Sahil, if I can begin by asking you, I think one of the biggest doubts and questions in everyone's mind is whether it is safe to access healthcare services in the midst of a pandemic. What would you like to tell our viewers?
Good afternoon, Rishika, and a big thank you to NDTV for inviting me as an esteemed panelist for today's talk. The question you've asked is a very valid one. See, as we always stated that, we always said that health is wealth, but it was never more relevant than today. Now, COVID-19, with all due respect to the doctors, the medics, the paramedics, the pharmacists, the police, every essential worker, with all due respect, it is here to stay for some time. Maybe a month, maybe 3 months, 6 months, a year, we never know. So definitely now we have to strategize, we have to make some lifestyle changes. Now with regard to your question, with regard to what is it safe to enter the clinic and what precautions we are taking for our clinic so that the patients can enter safely. Number one, as I would like to tell you, my clinic is in a building, it's in a society on the 5th floor, it's called Doctor House. So as soon as the patient enters into the building, the society watchman, he first checks the temperature of the patient along with the saturation. Of course, the patient has to wear a face mask. Without that, they are not allowed to enter into the building. So only once the temperature is below 99, or if for say the temperature is above 99 or the saturation goes below 94, these patients are requested to visit a nearby fever clinic or a nearby hospital. Once they enter into the building in the premises, that is in the passage, we have designated blocks where they stand waiting for the lift at 2 meters apart. Once they enter into the lift, depending on the size of a lift, our lift, we do not allow more than 2 people to enter. The lift, when they enter into the lift, they have the backs facing each other and the faces in the opposite direction. The lifts are disinfected regularly, twice to thrice in a day with sodium hypochlorite solution. And once they enter into the clinic, depending on each and every individual clinic, the protocols that we follow is that once the patient enters into the clinic, before entering, again, we get his temperature checked with the infrared thermometer. We have his saturation checked. We give a face mask from our side. We give him a shoe cover. And even before the appointment has been booked by the receptionist, we send them an online form. Right. Self-stating that they do not have any symptoms.
Right.
So like that, we try to avoid overcrowding, tell these patients to come on time, and not to get files with them. So contactless, basically to make them to have a contactless touch experience.
All right, very interesting. A contactless experience is what is being encouraged, and a form has to be filled out in advance where you can in fact describe if you have any symptoms at all. But Dr. Purnanand, if I can come to you at this moment, could you share with us, is it safe to do tests like ECGs, EEGs, other types of examinations at the moment? What about, something as routine as measuring blood pressure? Is it safe to do all of that at this point? What are some of the steps that you're taking?
So we have to make it safe because they are necessary. To measure the blood pressure and take an ECG or EEG is essential for patient evaluation and treatment. So we have to take precautions to see that the patient do not get infected or have an access to physical contact during this procedure. So we are taking special precautions by sanitizing the outpatient room before the outpatient and the timing, and after the outpatient timing, keeping the patients to minimum. Both the professionals and the contacts to a minimum is the one which we have been practicing. And we are using a disposable sleeve over the patient's hand so that the BP cuff can be handled without being touched with the patient. And Of late, we have switched on from the manual recording of the blood pressure to a digital mode where the patient, without touching the patient is not touched, the BP recording is placed on the patient's arm, and automatically you get to see the reading of the BP. That is the way we are now recording the blood pressure and monitoring them. And in many of the cases, patients are reasonably educated. We are advising the patient to do a home BP monitoring and get the readings of the patient so that we can have an idea regarding how the patient's readings are and what if the treatment decisions can be made. In patients who are coming with blood pressure for the first time, we are using ambulatory BP monitoring where a BP monitor is kept over the 24 hours or 72 hours depending upon the patient need, and we get the recordings, a flurry of recordings of the patient's BP where we can make a diagnosis. ECG also is a relatively contact procedure before COVID time. Now we had made it almost contact less procedure. Right. We are not using gel. We are using a sanitizer spray over the patient chest so that the patient can get an ECG without being touched. Right. And keeping a sheet, disposable sheet under the patient so that the patient does not touch the bed also, and making it less contact procedure.
All right, very interesting. I think, a lot of hospitals and clinics were already following basic sanitization procedures, considering the fact that you assume that, there are a large number of people who are coming in and a basic level of sanitization needs to be maintained even in pre-COVID times. But Dr. Jayant, if I can come to you at this point, what about doctors' chambers, where you are actually physically examining patients, several patients coming in per day? Do you have like a sanitization protocol where you sanitize in between patients as well? How does it work?
Yeah, we do take all the precautions to protect our patients and ourselves from getting infected. First of all, we give call patient by appointment so that too much gathering at the hospital site or clinic site can be prevented. We allow only 2 patients at a time in our examination chamber. We ask every patient and the accompanying person to wear the face mask. We ourselves use face mask, N95 mask and the face shield so that the chances of getting infected can be minimized. In chamber, we keep the chairs at particular safe distance so that the chances of infection is also prevented. We use disposable sheets on examination couch and for each patient, and that can be discarded. Also, as you asked, we sanitize in between. After few patients, like 4 to 5 patients, we sanitize the chamber, and again at the end of the day we completely sanitize our chamber. Right. And all. Yeah.
All right. So whole host of procedures there that are actually being followed. Dr. Sahil, if I can come back to you, who needs to see a doctor? I think that's the other big question that is on everyone's mind. What are the telltale signs? What do you tell diabetes patients, for instance? When is it important to come in? Do you need to come in for a regular checkup? Do you need to come in only at the onset of, certain alarming symptoms? What do you recommend?
Yeah, I think as far as possible, we do not encourage the patients to come for regular routine follow-ups. Of course, with the advent of telemedicine, communication coming in, it has become much more easier for us as well as for the patients. We in fact even have a dietitian who does a video consultation, and he provides a customized diet as well as physical activity plan depending on the patient's age, BMI and comorbidities. And with regard to specific symptoms for which the patients should visit the clinic or hospitals, number 1 is recurrent hypoglycemia. With hypoglycemia, I mean low sugars below 70, or if patients experience vision loss, then they should rush to the hospital. Secondly is hyperglycemia, sugars going more than 400, or a critical condition where the sugars are very high and patients can land up to diabetic ketoacidosis. That is where the patients should go to the hospital. Thirdly, again, other special symptom where patients should visit their doctors with diabetes are infections, where patients are complaining of fever, cough, breathlessness, and you're suspecting pneumonias. Fourth is vision loss, blurred vision, where you suspect diabetic retinopathy. Fifth is non-healing diabetic foot ulcers. Sixth is patients complaining of pain in the leg or cramping in the leg, which increases with physical activity, where we suspect peripheral vascular disease, which can be diagnosed on Doppler scan, and there is an index known as ABI, ankle brachial index, for which the patient should visit the doctor. And seventh is, of course, chest pain, retrosternal burning in the chest, or symptoms of stroke. These are specific signs and symptoms for which a patient should either visit a doctor or go to the nearby hospital.
All right, Dr. Purnanand, what about elders who have comorbid conditions? What are the extra precautions that they need to be taking?
These are the patients who are at very high risk of death during COVID times. These patients should be stay at home at all costs. That is the number one thing. They have to be kept in partial isolation even in the home. The people who are going to be in a close distance with them have to be specific about their personal hygiene, and the people who are going to take care of them for their regular activities and support, they should be screened, and any patient who has some symptoms of respiratory problem or fever should not be allowed to go near them. They should not move to any public places where there is a risk of contact with the COVID patient. That is totally a no in these all patients. Number three, these patients are likely to have many symptoms. So with the fear of COVID time and not seeing the doctor, these patients regularly complain symptoms regarding so many problems, knee pains, joint pains, or something or the other. So these patients should be able to be counseled that in these times it is very important to stay put at home and bear with some of the minor issues than complaining all the time. And if the appointment is scheduled, this appointment has to be strictly managed by the household members. They have to see that the transport has to be arranged, and this transport arrangement have to be very slick so that the waiting time is very less. And these people should maintain all the drugs which are been taking before the COVID times, and their blood sugars and blood pressures have to be monitored. Their weight has to be regularly checked so that they are accumulating water, because in heart failure patients, water accumulation is very common. And these lockdown times, they are keeping exercise away. So these patients should do the minimal exercise whichever is possible in the at home, breathing exercises, meditation, or biofeedback exercises to see that they keep fit.
We're going to step into a very short break, but our panel of expert doctors is going to continue to be live with us on the other side. To stay tuned.
Knowledge Partner, USV, your reliable healthcare partner.
Welcome back. You're watching Living with COVID. A panel of expert doctors is helping us answer questions on how to grapple with this new normal. Dr. Jayant, if I can come to you, what about thyroid patients? Extra precautions, extra care that they need to take in COVID times?
As such, there is no data to support that the thyroid patients are at high risk of developing this infection. But sometimes the thyroid patients do have some autoimmune disorders like diabetes mellitus, adrenal insufficiencies, or connective tissue disorders. Sometimes these patients are on steroid medications for these autoimmune disorders. These patients are at very high risk of developing the infections, and these patients should take the proper precaution as described by the previous speaker, that every patient should follow the necessary precaution like wearing the mask, avoid going to the crowding places, do take their medicines properly and regularly. But as such, thyroid patients are not at risk of developing these infections until unless they have associated other comorbidities.
All right, Dr. Sahil, I want to ask you, we are in the monsoon season at the moment, and with the change in season, comes an onset of flu-like symptoms to a lot of people. How do you differentiate between what is an ordinary flu and what is COVID-19, given the fact that there are a lot of common symptoms?
Yeah, I think a very good thought-provoking question. COVID and flu both are viral infections. Of course, COVID, as we all know, is caused by the SARS-CoV-2 virus, and there are in fact 7 kinds of COVID which are there, of which the 3 dangerous types we know are the SARS-CoV, which was in 2002, there was an outbreak. Then came the MERS, that is the Middle East Respiratory Syndrome. Then was your diagnosed now in 2019 SARS-CoV-2, while flu has been caused by is caused by influenza virus. So as you said correctly, the similarity between the two, the symptoms are fever, cough, cold, fatigue, body ache, muscle ache, and diarrhea, and both are spread through airborne respiratory droplets and contaminated surfaces. But the difference is that the incubation period means the time from which the virus enters the body till the onset of signs and symptoms is longer in COVID. It remains up to 14 days and can extend up to 24 days. While in flu, the incubation period is only for 4 days. Of course, the recovery for COVID is longer. In acute cases, it is 2 weeks, while in severe cases, it is up to 6 weeks. In flu, the recovery period is 1 week for mild cases, and for severe cases, 2 weeks. Breathlessness in severe forms of COVID are present, which is not seen in flu. And the most important, loss of taste and loss of smell is seen in COVID, which is not present in flu. So the carry home message is, if you have symptoms of cough, cold, fever extending for 7 to 8 days, it is not going in the favor of flu, then we should suspect COVID.
All right, very interesting. I think, to understand this analysis. Dr. Purnanand, if I can come to you at this time, what is the kind of correlation that one finds between COVID-19 and hypertension? And, at a time when a lot of people are actually undergoing a very stressful period, what would you recommend? How can they mitigate the circumstances?
So hypertension management has become a bit problematic during this COVID. Number one, it is because there is a fear of not seeing the doctor frequently, which usually happens when a hypertensive patient. So home BP monitoring gives us an idea regarding how his blood pressures are maintained. Number two, the panic situation what has been created because of the COVID is making the most of the patients' blood pressure shoot up than which were previously in control. Their blood pressures are shooting up because of the number of cases are increasing and the people's mortality rates are increasing. That is causing a lot of panic. Number three is these patients who are sitting at home are eating more than what is required and consuming more salt, and many a time they are consuming more alcohol. So weight gain and the increased alcohol intake are very detrimental for hypertensive patients. So these patients are likely to lose control of blood pressure because of these habits. Number four, there were controversies regarding the blood pressure medications. There was some panic created before that the blood pressure medications are harmful. So that also made some people to stop drugs. But now there is no controversy. All BP medications which are previously taken by the patient should be continued, and there is no problem with the COVID. So these patients should take their medicines regularly and see that the calorie restriction.
All right, Dr. Jayant, another follow-up question in terms of change of season. It's also a very tricky time for asthma patients. What should they be doing to effectively manage the situation at this time?
Yeah, all the respiratory diseases patient are at very high risk of developing this infection. So all these asthma patients should take they should take their medicines regularly. They should consult their doctor telephonically. Try to avoid going out or in hospital until unless very much necessary. They should have all their medicine in sufficient stock for this season. So act early, and if you have any symptoms, first consult your doctor telephonically, and if the problems are more, you can visit the hospital. So precaution has to be taken.
All right, precautions there have to be taken, extra precautions in fact for asthma patients. Dr. Sahil, what's the advice that you give to patients to manage diabetes effectively at home at this point in time?
In this current pandemic, we have seen 3 types of diabetes. Number one were those diabetic patients who already had diabetes. So they had a lot of glucose fluctuations because of irregular diet, no exercise, and they feared anxiety. Secondly, it was the stress-induced hyperglycemia, which was a bigger worry. And the third was COVID-induced hyperglycemia, because this COVID virus affects the multi-organs, and because of that, when it affected the pancreas, there was patients who did not have diabetes in the past presented with very high sugars, such high that they had to be put on insulin. So the important tips for patients to monitor the sugar is, to maintain the good sugar is, maintain routine basic care in the form of physical activity, control eating, keep good stock of medications, injections, insulin. People who are using glucometers should keep their strips with them, lancets with them. Keep a good eye on the portion size, avoid excessive carbs. In between snacking should be avoided. And most importantly, remain positive, remain stress-free, because fir muskarayega India, we have to remain positive. That is the ultimate motto, and we will overcome this.
All right, remaining positive being the ultimate motto. Dr. Purnanand, very last question to you. Any particular advice that you'd give for cardiac disease management at home?
So the cardiac patients, I don't ask them to get managed at home, but let them be not very anxious that not seeing doctor or there is an emergency. But they have to find out that where the doctor can be met in case of emergency and what is the hospital they have to move when there is an emergency. And they have to be aware of the symptoms which need immediate attention, like chest pain, loss of consciousness, or palpitations with a very high heart rate, or shortness of breath, or increase in edema, that is pedal edema, that is swelling of the face or legs. So these symptoms they have to be aware, and whenever there is a gain in weight or swelling of the feet, they should be immediately consult the doctor, sometimes on phone or sometimes personally, to see that their problems or medication has to be adjusted, and they should be taking their medications regularly to see that the problem.
Because you stress so much on medication, Dr. Jayant, very quickly, if I can ask you, what are the kind of essential medication that one should keep at home, or stock of emergency medicines at this point? What should some of those drugs be?
Yeah, patients should keep extra stock of all those essential medicines like the anti-diabetic medicine, antihypertensive, cardiac medicine, asthma medicine. They should be there for extra stock of these medicines should be there for at least 1 to 2 months. Other medications I generally do not recommend to keep in house, or otherwise to self-medicate ourselves, because many times these illness have mild symptom in the initial phase of disease, but later on there is a rapid progression. So always consult your doctor first, at least telephonically, and if the doctor wants to come you to clinic, then you should visit the doctors. Do not self-medicate yourself with newer medication. Those already are going on, you can take those, but don't take newer medication on yourself.
Right.
Always take your doctor opinion.
I think that's a very important point, and I think all doctors on the broadcast have stressed on that a lot, that you have to make sure that you're taking medication only under professional medical guidance. Do not self-medicate, do not read up online and therefore stock up on medications. A lot of medications have adverse effects and side effects as well. Thank you so much, doctors. You've been very kind. You've spared your time of day to answer all our questions so very patiently. Thanks so much for being with us, and thank you for watching.
Knowledge Partner, USV, your reliable healthcare partner.